In the previous segment, you entered information that helped determine your body mass index. No matter where a person is on the BMI chart, many of us could probably benefit from losing some body fat. We all worry about our waistlines.
I think I spent too much time worrying about what do people, look at my belly, and I should have been worried about what my heart was going through.
So why don't we just lose the weight? If you've lived life in an obese person's body, you know the answer to that question. You've heard family and friends tell you to just eat less, exercise more.
Yeah, I tried multiple, South Beach, Atkins, all that fun stuff.
I tried different places, actually, like Jenny Craig. I tried doing Weight Watchers. I usually could lose maybe 20 pounds here and there, but it would always end up, I would always end up regaining what I had lost. Yeah, I knew everything that it took, to lose weight. I knew it all, and I could not stick with it.
The other diets that I've tried, I would lose the weight, but I would gain it all back, plus some.
I lost 100 pounds 4 times in my life, gained it all back. I've tried diet pills, joined a gym, and even bought a treadmill for my home. Nothing worked.
I've probably gained and lost about 600 pounds in the last 20 years. I've been on all kinds of diets, all the prepackaged food, and I would lose some weight, and then as soon as I couldn't stand to be on the diet anymore because I was hungry all the time, I gained it all back plus some more.
I've probably been on every diet known to man with very limited success.
There's a pride factor. You think to yourself, I can lose this, I could start running or walking and jogging and lifting weights. I was kidding myself. I couldn't do those things.
If you're obese, you've tried those remedies, but it's not that easy, and it's frustrating that your friends don't understand that it's not that simple. Studies show that short-term, a combination of diet and exercise can result in a loss of body fat. Unfortunately, long-term, weight loss success is less than 5%. The studies for weight loss drugs show that their results are negligible, slimming your wallet more than your waistline. If dieting and exercise work for you, great, keep it up. But if you seem to be permanently settled in the high end of that BMI index, maybe it's time for something different. Medical advances have presented us with surgical procedures that can help severely obese people. One familiar option is gastric bypass surgery. It's been around for years, so we know a lot about it. This surgery involves altering the size of the stomach and intestines through cutting and stapling of the stomach and bowel. The advantage is that there can be rapid weight loss in the first year. There are risks of complications, including malabsorption of nutrients. Dumping syndrome, characterized by nausea, flushing, lightheadedness, and watery diarrhea, have been reported by most gastric bypass patients. The procedure is difficult to reverse. Another drawback of gastric bypass surgery is that it's not adjustable. But there is another more modern procedure that is, and it gives you more control. It's called adjustable gastric banding. It's much simpler and less invasive. There's no cutting or stapling. It does not result in permanent changes to your digestive system, and all digestive properties remain in place. What happens is that a surgeon places a band near the top of the stomach, essentially creating a small stomach pouch. When fitted properly, you'll feel full after only 8 ounces of food. The food moves through the entire digestive tract, just like nature intended, reducing the risk of malabsorption seen with gastric bypass surgery. With a gastric band, you will lose weight more slowly than with other surgical options, which can allow excess skin to better conform to your new size. The disadvantages include a slower initial weight loss, and you'll need regular follow-up with our experts for optimal results.
I would definitely recommend you learn everything you can about it and you make your decision from there, because I think most people are going to find that it certainly behooves them to get the surgery.
In the next segment, you'll learn more about the adjustable gastric band and why that procedure might be right for you.